Welcome again to the Healthy Parenting Connector. I'm Katie Kimball for Kids Cook Real Food, and we are here with a return guest, Dr. Roseann Capanna-Hodge. We have talked with her before about anxiety in our kids, and Dr. Roseann is just a fantastically brilliant psychologist and counselor. She started out kind of traditionally trained, and after one patient completely changed the way she thought about working with the really tough cases, the toughest cases with the kids. She's now a well-known media voice for integrative mental health. She's helped thousands of people, thousands of parents and student patients. And she's the author of Brain Under Attack, which is a resource guide about PANS and PANDAS. That's actually what we're talking about today. I feel like it's like this new up and coming disease. I barely know much about it. PANS meaning P-A-N-S all caps, PANDAS all caps as well. So Dr. Roseann, first of all, people need to go to our first interview, which was awesome to hear your story. But second of all, let's dive into this PANS and PANDAS stuff, like definition. What are we even talking about?
So PANS and PANDAS are two separate conditions that are really ultimately produce the same things. And then we have autoimmune encephalopathy. I'll talk about that too. So, but really what happens, both based on an infection, that a misdirected immune response in a person's body, and the body starts attacking itself and produces tons of inflammation, which creates a sudden onset of a psychiatric issue. And most commonly, but not only, rage, OCD, eating disorder, as well as regression. So can be regression of bladder function, also can be frequent urination is a real telltale sign, but also regression of balance, walking, handwriting, math skills, and then a whole host of issues, as well as just straight anxiety, depression, you name it, can come on suddenly. And that's what PANS and PANDAS is about. An autoimmune encephalopathy is the same, except it's not a sudden onset. It's a waxing and waning of symptoms. We're starting to broaden our definition in that there's a lot of overlap between all three, but ultimately it's about, you can have no issue, pre-existing condition, or you can have already a pre-existing condition like some level of anxiety or autism, and then there is a sudden acceleration of symptoms. And it is, you said, it seems like it everywhere. It's really dramatically in the increase right now. The research says it's 1 out of every 150 to 200 kids in the US. So it's a lot of kids. It's one of the main reasons people seek me out in Ridgefield, Connecticut, because there's just so few practitioners trained in this. Very, very limited, like a few hundred people are trained in this. So people often have to travel and seek advice. And then, and one of the most common, so PANDAS is strep infection, and PANS can be any infection. It could also be strep, but you can have other infections at the same time. So a lot of people fall into the PANS category because they have multiple infections. So they might have strep, Lyme being one of the most common, as well as the flu is a common infection. Epstein-Barr is very, very common.
Which is mono, right?
Which is mono. And then they love to commingle. So I always say, like, when one shows up, the other ones come to the party because the immune system's down. And then it really can cause this acceleration of flaring of symptoms. So it's a really difficult disease, particularly when, it's certainly difficult when your kid already knows you have an issue, but when I have so many neurotypical kids that are, normal, and particularly when their parents are, feeding them really healthy food and they're moderating their stress, and then overnight, strep infection, wake up, OCD 6, 7, 8, 9 hours in the day. And, people are baffled. And the problem is they go to a medical provider and they're just not familiar. And so they don't know it's a medical issue, and they send them to a psychologist. And if behaviors are very extreme, like the rage is really extreme, they're threatening or aggressive, where do you land? A psychiatric hospital, which is so frightening for a child. And also psychiatric medication isn't going to fix. This isn't a biochemical problem. This is a medical issue. It's an infection that needs to be treated. So it's, really, really important that we get the word out. And I'm so appreciative that you're doing this interview, because the more people know, the more they can demand care.
Yeah, it sounds like a very difficult to diagnose issue for both for even just parents to even guess what it might be, and for practitioners. I'm trying to wrap my brain around it. So is it fair to say, accurate to say that this starts with something physical, some sort of infection in the body, and then the symptoms are manifested as psychological, but the root cause is still really physical?
Perfectly said.
Absolutely. Okay, well, you explained it great. I was like, I can do this. I'm still following.
So that's exactly what it is.
And it's quick. It's acute onset is the A, right?
And the autoimmune encephalopathy. So for those of you who are Lyme folks, right? And I have a child with Lyme and PANS, and I was involved with Lyme long before I had kids, because I live in the Northeast, and everybody has Lyme. So you better get up on Lyme. And, as you know, you hear my origin story. When I see it, I believe it, and I learn. I make sure that I learn and integrate that, because we need to provide the best possible care for the people that show up on our door. And as a mom, there's nothing like seeing a mom in distress. I mean, there just isn't. And a mom is, one tough cookie. And so, to get those resources to that mom so that they can, and the dad too, but to parent to make these decisions for their kids, it's a really lonely journey to have a special needs kid, but also to have a kid with a heightened mental health issue. You don't know where to go. You're being sent to a psychiatrist or a psychiatric hospital. You're not typically given the right answer. Now, even though people are getting more savvy about this, how we diagnose, there's a lot of controversy around these diseases. These diseases have been around for decades. It's well documented, and there's like politics as to why this hasn't been as widely accepted as it is. But it's real. I mean, kids don't just wake up and be different. It's hard to deny that. And that's the puzzling part of this, right? So, a lot of pediatricians are really on the ground here, and they're the ones, seeing these kids. And some pediatricians are super open and really wanting to learn, and some just are resistant. And, this has been going on in the Lyme community for decades and decades and decades. And so with autoimmune encephalopathy, there can be a slow waxing and waning, where there's an acceleration and then it seems to get better, and then there's an acceleration and it seems to get better. And people don't realize that, why so many people, why does one person get bitten by a tick and it's fine and another person doesn't? A lot of it has to do with detoxification issues and genetic mutations. That's a whole other topic. But we don't know enough about it. But we do know that when the research is very, very clear, in the 90s, people used to be given long-term antibiotics with Lyme disease, typically 2 months. And then it went down to a month. And now, for unknown reasons, none of us in the Lyme community can figure this out, it went down to 2 weeks. And here's why this is so important, that a spirochete, which is what, a tick carries, takes 28 days to cycle. So if you're giving less than 28 days of antibiotics, you're not going to kill the bacteria. So what happens to bacteria, it looks different in everybody. Sometimes somebody gets a tick bite and they're sick. Like when you get a fever, you are lucky. You get a spiral rash, a bullseye rash, or any other kind of rash, you're lucky, because that doesn't happen that often. It's such a misnomer that it's such a telltale sign. So with this antibiotic use, when you're only doing 2 weeks, there can be a real deep acceleration of symptoms in a short amount of time. It actually can worsen things. But most people, they do their 2 weeks antibiotics, they feel a little better, and then they're not making the connection that it's 6 months later, a year later. And so that connection gets lost. So parents or individuals don't even know to ask for the right care. And that can really contribute to some of these real serious cognitive issues, as well as milder ADD, memory issues. You know, you have to, you know, in order to be ADD, you have to show those symptoms before age 7. You know, if you're a 47-year-old and it shows up overnight, something's wrong. You know, and I think that's what I want people to know, that when you know something wasn't there and it's significant, you need to seek help as quickly as you can.
Okay. You use the phrase puzzling part, and it's such a puzzle. I think something that's been fascinating for me following you on Instagram and kind of getting to know you is that there's all, you know, you obviously talk about anxiety and depression and sort of our typical mental health issues, but you also have to juggle these pieces that might surprise people that they're in the mental health category. Lyme, concussions,
Yeah.
you know, you talked about strep being like a genesis of this. What are, other than maybe being bitten by a tick? So like if I want to tell a story,
Yeah.
you know, my kid got bitten by a tick, what was that, maybe 2 years ago? And you know, it is different since then. I can't say exactly when it happened, right? But I
Yeah.
remember 4 years ago, he was sweet and good in school, and now he's having trouble in school. Is that sort of a potential story?
That's very, very common. You know, like here's a common story. I recently saw somebody who's in their 20s, and they saw over 20 practitioners before they figured out it was Lyme. And he was extreme. Like he lost his ability to walk and was in a hospital. And they still didn't figure out it was Lyme. This is what I don't understand about where we, you know, in the Northeast, like it's literally like if I went and rolled around in the grass right now in the cut lawn, I would have ticks on me. Like, yeah, they're so little. I know, it's like, there's no earthing going on for me. It's just not happening. So, unless there's a tarp down. So anyway, but a typical story is exactly what you said, that there was, you know, was bitten by a tick, and, you know, we did the antibiotics, and then all of a sudden I got a little OCD or anxiety or his personality changed, and then time moves away from that. And the same can be said with things like concussion too, but
Okay.
and you know, those tend to be conditions where people don't make a connection because we're always looking for our medical provider to be God and like to make that. And this is where I'm always about empowering parents. Parents need to trust their instinct and dig. And I love Google. I love the internet. I love that people are like, heck no, that doesn't make any sense to me. I'm going to figure this out, you know, and I work with so many empowered parents, and I love it. And, you know, that's a trend that's a real positive trend that I've seen in the last few years, and I'm really glad about that.
Good. Yeah. So just to kind of get a list in one cluster, possible risk factors would be Lyme, strep, concussion, any others to kind of look out for?
There's a long list of infections.
Oh, okay.
So like herpes 6, which is a common cold, Coxsackie, mold. An exacerbator can be vaccinations if your immune system is already down. And I don't want to get into an anti-vax discussion, but we know that when you're immunocompromised, that you're not supposed to have vaccination, so it can really worsen things. But any type of virus and infection, and as I mentioned, mono and Epstein-Barr. Epstein-Barr is as devastating to the immune system as strep and Lyme disease. Those three are horrific. And strep is such a tricky beast because dogs can carry it. Other people in your family can carry it without being symptomatic, and you can actually keep passing it around. And it can be such a detriment to really bring on these mental health issues for kids and really even adults. So even though we call this, pediatric autoimmune neuropsychiatric syndrome, this is something that doesn't have an age limit on it.
Okay. Well, that's really good to know. I'm like, I can think of people in my life who have trouble with, they get strep every darn winter.
Yeah.
And oh my gosh, they're anxious.
Right. And
now.
they're anxious. And it doesn't mean that you have to have the extreme versions of the behaviors. So you can have behaviors that are more on the low cycling. And the other important part about PANS and PANDAS and AE, that anytime you can be pretty close to within a normal range in terms of like your mental health and your functioning and processing, let's say like 90-95%, because you've done, you know, treatment and work, but you can have flares at any point. And so other things can worsen it. So again, like you have Lyme, and your sister has she's Coxsackie, and, you know, which happens all the time, you know, and boom, you destabilize. Doesn't mean you're fully going back to zero, but you can have a worsening of symptoms. For most people, it's weeks. So that's another factor where people like return to baseline, and then the symptom worsens quite significantly based on, I'm going to move out of the sun, sorry.
No, you're turning into the halo angel.
Yeah. And your symptoms can really worsen because of other infections or even stressors in your life, like really stressful periods, lack of sleep. Those are important. But we do know that really any infection can bring on the onset of this disease. And it was really interesting. I had a reporter ask me last week, like, shouldn't every pediatrician be telling you when you have strep or Lyme to look out for these things? And I said, wouldn't it be nice if they gave out a fact sheet?
So we know, I feel like I know a little bit more what to look for, and I feel more confident in that. But now, like, I'm dying to know, what's the root cause approach to treatment? What do we do?
Yeah, so we don't have a standard of treatment, and we also know there's a bio-individual approach. So, you know, my philosophy in reversing any issue is really to stick to the foundation, you know, of healing, so that nutrition, identifying nutritional deficiencies, detoxification, genetic mutations. So most people with chronic health conditions, autoimmune, have genetic mutations which interfere with detoxification and how the nervous system regulates, with MTHFR being the most common. And like Google it and you'll be like, oh my gosh, you know, I have it, my kids have it, all my friends have it. It's just, you know, they say that at least 50% of the US population has it. I'd say 95% of the people that walk through my door have it.
Okay.
And
because it's a risk factor, because it's causing them to not detoxify well.
Exactly.
And then if that person's exposed to the same thing as another person, they're weaker.
Yeah. And you know, tick-borne illnesses, bacteria, viruses, they carry waste products. And the waste products, along with just normal toxic loads that we have, you know, in our environment, because we do, make it where the system can't clear these things and cause autoimmune agitation, you know, inflammation, and make you more likely to be unable to clear simple viruses, things you're not supposed to. So addressing those deficiencies, as well as we have to do antimicrobial, antiviral treatment, and that can be traditional treatments like antibiotics, antivirals, as well as herbals. The research is really, really clear that particularly with Lee Cowden's work, in particular, herbals are as effective in the treatment of the Lyme bacteria versus doxycycline. So, you know, you got to always look to the research. Everything I do is research and evidence-based. Not to say there's not new and upcoming, you know, therapies and stuff, but, you know, these are very serious conditions. So some people also do straight immunotherapy like IVIG. That's a really, really difficult type of treatment. It's extraordinary expensive. It's not easy, but it's life-changing for some people. And so, you know, starting with looking at the true platform to get the brain and body online, the anti-inflammatory diet, all those things, lifestyle adjustments, really getting the nervous system to calm down. And that's why people come to me, because we now acknowledge that the two biggest barriers for healing for many people are, or, you know, besides inflammation itself and reducing your diet, is and most of my clients are willing to do that, is the detoxification, the lack of detoxification, and the overstimulated nervous system. So we're using biofeedback, neurofeedback, PMF different types of real specific psychotherapy that people can use on their own to really, really get that nervous system to calm down, so the body can actually do its work instead of constantly being in this overactivated state, and the natural killer cells are looking for this stressor and ignoring the bacteria. Once the nervous system calms down, physiologically the body can attack the bacteria appropriately.
So a lot of this is getting blocks out of the body's way, it sounds like.
Absolutely. And turning on the body's, you're right, healing power, right?
Okay.
And you know, what can we do? And people need to know there's a lot of hope, there's a lot of power in doing that. And you know, obviously we're supporting parents when this happens. This is so traumatic for everybody. I mean, this is frightening. And you know, you're frightened for your child, you're frightened for the lack of care they're getting. You know, very few mental health practitioners will support a kid like this because they just don't know what to do. Plus, they always view them as a liability risk if they're aggressive or, you know, have feelings of self-harm. But, you know, there's a way to support these kids and their family, and they deserve it.
That is good to know. And I feel like as a parent, what you're saying is what I need to know as a parent, what our audience needs to know is some of this cause and effect. Like we need to understand that we might have to go outside of our normal pediatrician or outside of whatever recommended psychologist we're sent to if we see that acute onset. We know there's been some sort of potential infection in the last year or two, and just have that power of knowledge to get our child the help they need. But this is not something that you just kind of like take care of at home with Dr. Google.
No,
you need help.
Can you do things to help support the treatment? Of course.
Great.
But you want to get to you know, a PANDAS, Lyme specialist as fast as you can. You know, the best way to do that is to ask a friend. If you have an amazing pediatrician, which doesn't always happen, you can ask them, but you really want to make sure they are a specialist, not even just literate. We talk about Lyme literate or PANDAS literate. That just means they know about it. They're not an expert. So there's a slim grouping of people. Like we're all trying, and I'm training other people. Like I'm trying to make it on a much larger scale, because this is just insane, this level of that it's happening in our universe. But you can go to a national organization called Aspire, or you can go to pandas.org and you can find providers through them as well. And my experience is that functional MDs and naturopathic physicians do often have training in this, but call. And then, you know, always trust your gut. Does it sound like this person knows what they're talking about? Or does it seem like, you know, it's a load of baloney? And ask them, how many times have you treated somebody? You know, it's, and you can have people that are super kind-hearted and lovely, and if they just don't have the experience, it's going to interfere with your healing.
Right. Yes.
So and we really don't want to mess around.
Yeah, we need to find competent, experienced practitioners. You mentioned there are things parents can do at home to support the healing. As a kids cooking teacher, I'm always wondering how nutrition plays into this, either as a preventive factor or healing factor.
Yeah.
Is it a part of the
It's critical
equation?
It's absolutely critical. It's probably one of the biggest things parents can do to control and support their child, because we know that, and this means no wheat, this means no dairy and no sugar, period. And I'm sorry, but this has to go on for at least 90 days minimum, and then you can talk about reintroducing things, and it certainly should be organic. But you need to do everything you can to reduce inflammation, and diet is the quickest way to do it. And so, and what I always say is do it as a family, and you're all going to feel better because you're all stressed out. You're all worried. You know, I mean, I can, you know, tell you as a mom who's gone through this, it is brutal. It is absolutely brutal. And you will lose your support system because people don't know what to do to support you in this. So I hate to say that, and I'm going to hope that's not the case for you. But when it comes to such severe mental health issues, people are afraid.
Right. It's hard to understand, especially when a child was more
Yeah.
like you say neurotypical, we'd say normal.
Yeah, yeah. And I mean, I can't even tell you how many mothers share this with me and their journey. And, you know, some of them are, you know, heads of their churches and teachers and, you know, people that you think, wow, nobody would ever do that to them. And I'm not sure why that happens. All I can tell you is I think that there's a fear. And so for those of you that your kids aren't PANS, but you have a friend, you know, reach out and say, is there anything I can do? Can I get you a meal? Can I take your other kids out? Like, can I just be there to hold your hand? Like, it's a very scary process. And that's what people need is love, right? And community. So that definitely is a big deal. But for sure, you've got to find a really qualified provider. And I'm hoping that's growing. I just can't imagine that it's not, because this is, as you said, and really on the rise.
Yeah. Well, thank you so much. I think this is, I'm guessing this is very new information for most of us out there. Incredibly important. Find a qualified practitioner if you think this is going on. And, you know, I want to leave people with a message of hope, but I think you just did that. Love your neighbor if they're dealing with this, and there is hope. The kids can heal from this. That's the bottom line, right?
Kids can heal. And, you know, if you want more information, the book that I co-wrote is 100% of the proceeds go to a lovely organization called Epidemic Answer, Brain Under Attack. You can get it on Amazon. It's got some like really good basic information, and it's a place to start and to help know where you need to go. But yes, you need to have hope, and you absolutely can turn this around.
Good to know. PANS and PANDAS, we're going to hear about it a lot more. And I know that this interview will bring a great deal of hope to parents who are wondering, what the heck is going wrong with my child? And maybe it's this. And if it's this, it's good to know. It's good to know your enemy, because then you can fight it with the right weapons, right? So this has been Dr. Roseann Capanna-Hodge, incredibly amazing practitioner from Connecticut. I'm Katie Kimball from Kids Cook Real Food for the Healthy Parenting Connector, and I'll see you back next week with another expert who has the information you need to raise those healthy kids. Thank you for being with us today.
Thank you.